Hello, 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 everyone, and welcome to the Dr. Tamara Beckford Show. I am excited to have you here with us today. Now, today is for all our busy people who uses being busy as an excuse for not exercising. I'm not saying anything. I'm not raising my hand or anything. Maybe I am. But this is really to help all our busy people to recognize that how exercise is so important. So we have one of our docs here who is an exercise enthusiast. She is a parent. She has used exercise to overcome burnout, and she's going to give us all the scoop and how she did this. All today on today's session live with Dr. Tamara Beckford. Hey, Dr. G, thank you so much for joining us. All righty, let me bring our doc in our wonderful fashion, right? Now, before we do all of that, I know some of you guys are like, hey, I might not be able to catch the whole episode. You know what? Have no fear, because this wonderful episode will be available on our Your Caring Docs website. That's URCARINGDOCS.com. Select podcast. You see our doc, boom, you see her beautiful face, boom. Download that episode and share it with 10 of your friends who all of you guys have decided, you know what, after today, we're going to exercise together. Yes. All righty. Let me bring her in. So this wonderful doc of ours, yes. So she's a graduate of Drexel College of Medicine in Pennsylvania. All my Philly people, hello, hello. She's one of us.
Philly.
Yay, yay. Then she did her residency at Wellspan York Hospital in York, PA. She did her residency in family medicine. Now, she's a board certified family medicine physician. She's a mom of four, an exercise enthusiast, and she's passionate about wellness, preventative care, and she loves to inspire others to move. I'm like, okay, you got a big job today. I love it. I love it. So she strives to stay active daily, and she sees the massive impact that has not only on her physical, but also on her mental health. She's seen all of these benefits, and therefore she drives us to do the same, which is what she's going to do today. She's going to talk about staying committed to exercise, especially as a busy mom of multiple kids. So she's going to give us the scoop, because 4 kids is not easy to do that and to stay enthusiastic and daily moving. And not only that, but she's going to really drive to us how she was able to use this love for movement and exercise to overcome burnout. So if any of you guys are headed into Burnoutville, today's episode is for you. Who am I talking about? I'm talking about the one and only Dr. Sara Ionescu. Woo! Woohoo! All right, Dr. Sara, welcome, welcome. How are you today?
Thank you so much, Dr. Beckford. It's wonderful to be here. I appreciate the opportunity.
Hey, I appreciate it, because you have a big job today helping us to
Yes,
stay.
it sounds like it. I hope
I
I'm
love
ready.
it. All righty. So before we get into that portion, we want to get to know you a little bit better. So
Sure.
tell us, when did Sara decide, you know what? I want to become a doctor. Now I don't need my 20s. Why do I need my 20s? I'm going to go
Yeah.
ahead and study all the way through it. But tell us, when did you decide to become a doctor?
Sure. So I actually was one of those kids that from a very young age decided that I wanted to be a doctor.
Mhm.
I had this wonderful, warm, kind pediatrician growing up. And we saw her, my brother and I saw her basically like from birth until we were 18.
Well, you
And
got
so
kicked
we
out.
really, yeah, right. It was like, okay, you guys are adults, like, gotta go. It's time to go. But so over the years of just interacting with her and seeing how much of an impact she had on our family and how much
Yes.
help she was providing to us, it was just like, wow, I think this is the career path that I want to go down. And as I went through higher levels of education and found my strengths to be more in the like science math zone, everything kind of just all came together where that seemed to be the right career path for me.
I love it. I love it. You know, there are a lot of pediatricians who have encouraged this generation. So all my pediatricians, shout out to you all my family med docs who are taking care of the patients from the
Yes.
younger age, because a lot, and I've interviewed a lot of docs. We're over like almost 250 right now.
Oh my
And
gosh.
so many of our doctors, they had great pediatricians, they have great family medicine doctors who encouraged them, and just through their passionate care for them or a family member, because there are also so many people who they might not have been the one who were ill, but they saw
Sure.
how someone was being taken care of. And you're inspiring us, especially in a generation like this, to keep going. So, and to keep
Yes.
the medicine, for the love for those who want to take care of others, to keep it alive. So shout out to my
Absolutely.
pediatricians. Alrighty. So there, we love our pediatrician. Is she around, your pediatrician?
I'm not sure. I moved away. That was back where I'm from originally, which is New England. I'm not sure if she's around anymore.
Okay, because we usually like to give our doctors a shout out.
Sure.
So give the doctors a shout out. All right. So, all right, we're there. You decide, okay, I'm strong in the sciences. I love my pediatrician. She's so nice. She's taking great care of me. I'm going to be just like her. Boom, we're in med school. I noticed you're not a pediatrician. So,
Yeah.
what made you
Yeah.
decide to do family
So
medicine?
from the first day of med school, I was like, that's it. I'm going to be a pediatrician. Like I
Yes.
had my mind set. That was what was going to happen. And then I got to my third year where we do more clinical stuff. And so I started getting to experience all the different specialties. And every rotation I did, it was like, oh, shoot, I really like that one. I really like this one. I like doing procedures. Oh, wait, I like women's health. I like grown-ups sometimes. Like, and then I started to get in this panic of like, if I do peds, I'm going to exclude some of these things that seem to be, I have a passion for.
Yeah.
And my entire fourth year was set for peds. I had all my rotations set up. And my very last rotation of third year was family medicine. And literally the first day, I was like with a resident and an attending, like every patient encounter was wonderful. I immediately, like from the moment I was there, just felt like I belonged. It was like this different feeling than other the first day of a rotation is always like, yeah, you're like a little nervous on the first day. And it was like instantly felt so welcome, so belonging. And then I immediately panicked and was like, I have to do family medicine. What do I do? Like I literally threw my entire fourth year schedule out the window. And they helped me figure it out. But yeah, so that was how I chose family medicine, because I just had a diverse array of interests, and that was just what lined up the best with me.
I love it. And it happens to so many people.
Yeah.
No, I asked this question because do you know how many people come in and they're like, I'm going to be a pediatrician.
Yeah.
And then they start looking at the other end and end up being OB, or I'm an OB, and then they're pediatricians. So that's why it's so important to be able to rotate, to do the rotations, to have your foot in the door, to give, to be able to
absolutely
see and have an inkling, like this is what the lifestyle will be. This is what I'll be doing daily. It's different when you have an interest versus when you're actively working in that specialty. So many things change at that time. Alrighty. So now you've thrown yourself into a panic because we're like, oh no, it's the end of third year. Fourth year, and for those who are listening, they're like, why would you be in a panic? Well, fourth year is when you start to do your interviewing for the residency programs that you want to go into. So you've already kind of organized yourself. And if for those who, if you don't know most doctors, we're kind of like type A. We're like, oh, I'm set. I've organized everything. I've crossed my T's and I've dotted all my I's, and I can't wait. So when things kind of erupt this way, you're like, alrighty. So now I've changed. Eruption occurred. We were able to fix it. And, shout out to all of those in administration in our medical school who have to deal with us going through that. Yeah. So now you're doing, you've graduated and you're doing, residency. And did you start your family during that time, or did you start family afterwards?
So I got pregnant the last year of my residency, and then actually delivered like 2 months after I graduated. So
Okay.
I was pregnant at the end of residency, but didn't really start having the family stuff until afterwards. Yeah.
Okay. So one of the things that you have mentioned, you're an exercise enthusiast.
Yes.
You love to exercise, you love movement. A lot of people, and I remember when I was in med school, I was drowning.
Yeah.
And if someone says, "Oh, go exercise," I'm like, "All right," but my movement was movement from my, dorm or the where I was living across the street to the library. And that was movement, chugging along these big books. That's before everything was super digital. But
Sure.
at the same time, there were some people who movement was something that they just had to do. Were you one of those people?
So a little bit. I
Hmm.
was an athlete growing up. So
Oh, okay.
I was a competitive swimmer like from the age of 5 through
Hmm.
college.
Mm.
And then in med school, I still craved that exercise, but
Hmm.
I was struggling with how to fit it in
Right.
because obviously your life is very different in med school compared to college. And then I had a little blip in between where I worked a regular job. And so I was
Hmm.
used to having more free time. And then
Right.
med school, it was like, oh boy, like where am I going to fit this in? And
Hmm.
so I did stay active during med school, but definitely not to the level that I was before. And
You
then when
are
you,
a competitive swimmer. Look at you. I definitely weren't prepared for the Olympics while in med school.
no, no. But then, then you throw in residency and marriage and kids, and it just kept getting like the layers kept adding on and it kept
Yeah.
getting more and more complicated. And the challenge of finding the time and figuring it out kept getting harder and harder for me,
Hmm.
basically.
Hmm.
And so for me, really what helped me make a shift was redefining exercise.
Ah.
Because I grew up as an athlete, exercise to me was I must be working out for at least an hour, a lot of times 2 hours. I'm very sweaty, like it's very vigorous, high heart rate type of stuff because that's
Hmm.
what I was raised in. And
Absolutely.
then at some point, I think really this shift started with my first child when I was postpartum, and then has like continued through each pregnancy and delivery.
Hmm.
But it really was, there was a moment in time where I was talking to a patient, and I always tell my patients, like, can you find at least 1 minute a day to exercise? And
Hmm.
almost everybody says yes. And a lot of times they're like, oh, like they don't want to say it, but it's, how can you say no? I can't find 1 minute. So
Yes.
usually they'll say, I can find 1 minute. And I was literally like saying this out loud to the patient. And in my head, I was thinking, why am I not listening to this advice? Because what
Hmm.
I was doing is if I couldn't find an hour or 2 hours to vigorously exercise, I just didn't.
Hmm.
So in med school, I knew my husband then and we were both active. And so maybe, once or twice a week, we would go to the gym or go for a run, do that vigorous exercise. But there wasn't really a consistency to it like I have now
Hmm.
because I was of that mindset. If it's not an hour, it doesn't count. So I'm just doing nothing. And
Right.
then I had that funny aha moment, like in a room with the patient. And I walked out of the room and was like, I got to start listening to myself. Like I'm saying, like I'm helping and encouraging these patients who are then coming back a few weeks later and saying like, hey doc, I did the minute you said, and now I'm doing 2 minutes and now I'm doing 5 minutes and I'm doing it twice a day. Because what happens is when you start to do something every day, you realize, oh, hey, like I'm succeeding in this.
Yeah.
Let me keep doing it. And
Hmm.
so that was where the mindset shift really happened for me. And then it became easier to be consistent because the bar was just more in line with my phase of life at the time.
Mm. That's a huge, huge shift in mindset. And what you just stated, the bar was more aligned with my phase in life. And I think for most of us who find it challenging because we're just naturally, we have some people who are just naturally enthusiasts. And to hear it from someone who's an enthusiast, but still having a challenge, yay for
Mm-hmm.
those of us who aren't enthusiasts, but
Yeah.
still have the challenge. But you're saying that the different phase in life, and just recognizing and appreciating the phase in life where you are, and moving along with that and working with where you are, and
Mm-hmm.
just keeping that bar at a level where you can use it for enthusiasm, and you're not using it for mental punishment. Oh, there I go, I suck, I told myself I was going to do 28
Right.
days and blah blah blah. We know how those negative thoughts really try to permeate through the mind. But as you mentioned, just really keep it in mind for the phase where you are. And it's important why you say that, because we have to remember that we're always changing, right? So you
Right.
have so the person with the number one, we're always getting older, which I have to recognize, with tendonitis here and tendonitis
Yes.
here and bursitis here and blah blah blah, all this inflammation. Yeah.
Yes. Ouch.
I get upset at myself, like, why am I not able to lift like I was 5 years ago? Well, now I'm 5 years older, right? I
Right.
have to recognize that about myself. And so for those who are listening, these are things that we keep in mind. And for those who are going through the phase where you're starting even families,
Mm-hmm.
like the
Yeah.
time and your body has changed between number one and number two, and even number three, and the different phases. For those who are like the males who are listening to this, who are like, well, I'm not delivering a woman and I'm not delivering a kid. Yeah, but when you're there,
Right.
life has still changed for you, right? The dynamics of parenting and also the dynamics of your job, there's still so many shifts that occurred. So adhering and honoring that phase in life where you are is something that's important. So I love that you're saying that. All righty. So now we're doing that, we're honoring and we're recognizing, wow, just a minute a day, a minute in the morning and a minute in the evening. For someone who's just like, man, I can't do anything in a minute. What are some things that you can tell them? Like, no, yeah, think about this, even
Yeah.
just to
So
start.
absolutely. And I would tell patients sometimes, like, you don't even need to get your shoes on. Just get up, walk a lap around your couch. If you have stairs in your house and you can safely do stairs, walk up and down the stairs for a minute, do a lap around your kitchen, because any movement is better than no movement. And truly, I mean, a minute, in my opinion, is better than zero. And I think that sometimes patients would struggle because a lot of times they would hear the guideline is 30 minutes, 5 days a week, vigorous activity. And they would say, well, there's no way I can do that. So I'm just doing nothing, like exactly the mindset that I
Absolutely.
had. And that's where I
Mhm.
would say, like, hold on, pump the brakes. Let's evaluate where you can find tiny pockets of time and just get
Mhm.
started. Like, even if it is a minute, it's still a minute. It's better than sitting on the couch for the entire evening, even if you get up and move for that 1 minute. And a lot
Mhm.
of times, what people would say is, doc, like, once I was up, I kind of felt like, why would I sit down after a minute? It's sort of like if they had the TV on anyway and they were up, like, they started to realize their brain thought, hey, like, I'm already doing this. Why stop now? And that may not be every time, but I think you start to see how doors open and how you can get to being a regular, consistent exerciser where
Mhm.
maybe it does expand to 20, 30 minutes, especially when you start to see the benefits. Because I think sometimes there's so much focus on like the physical benefits, okay, weight
Yes.
loss and heart health, which is so important. And I'm so passionate about that. But
Mhm.
mental health benefits of exercise are humongous also.
Mhm.
And I
Mhm.
think they're not always talked about as much.
Yes.
But I mean, especially for people that spend a lot of the day like in their home, there's not a lot of other interaction, like
Mhm.
just moving around can lift and lighten your mood. It's unbelievable.
Absolutely. With interviewing some of our psychiatrists and our colleagues, so
Hmm.
the first treatment for depression is
Yeah,
movement.
absolutely.
It's
Absolutely.
movement. And a lot of times you're right. We do overemphasize the physical benefits of exercise, but we're not emphasizing a lot of the mental benefits of it. Now, talking about that, something, we will also talk about in addition to the physical benefits and movement is its effect on burnout. So let's talk about burnout for you. Have you experienced burnout before, and what did it look like for you?
Yeah, absolutely. I think when I was living it,
Mhm.
I'm not sure I fully recognized it, but
Yeah.
for me, what it looked like was a lot of it was really internal. So a lot
Mhm.
of it was mindset stuff around wanting to do it all, wanting to
Mhm.
do it all perfectly, and
Mhm.
wanting to make sure that I was filling everyone around me in the way that they needed. And then many times at the end of the day, there was just nothing left for myself. And it
Mhm.
took me a lot of time to figure that out. But really, that's what it was for me. Like I was pouring out to my patients and, my kids and my family. And I don't regret any of that, of course. Like that's the phase of life that I was in. But what I missed in those times was like taking care of me and
Mhm.
how important, even just if it's a couple of minutes a day, like how important that time is. And
Mhm.
so ultimately for me, the way that I started to overcome some of that, and again, like I didn't recognize this in the moment. This is all like in the last year or so, I've really started to think about those times. And
Mhm.
for me, it was the exercise. It was
Mhm.
like I made a commitment to myself. I'm going to figure out how to do it, even if it's a few minutes a day. And it wasn't always solitary. A lot of times there were kids somewhere involved in that. And
Mhm.
I incorporate them into my routines a lot because I want the whole family unit to be healthy and active. But
Mhm.
so it was really that, like, for me, the way to overcome some of that was movement because
Mhm.
it was my version of taking care of myself, my health,
Mhm.
both physical and mental.
Mhm.
And taking that time for myself allowed me then to have more to give others, if that makes sense.
Absolutely. Absolutely makes sense. And you're really talking about like we're saying, the benefits of movement on burnout. So with burnout, based on your description of what it did for you, the what it did for you was the depletion. So you were just like emotionally exhausted,
Yes.
from burnout. And the reasons were you were a giver naturally. You're in a profession
Yes.
that's
Right.
what we do. We
Exactly.
give,
Exactly.
and then you're a mother. So that's what you do. You give, you nurture, you give, you give, you give. And then you recognize at the end of the day, you have given so much that you had nothing for yourself. So the emotional exhaustion, the depletion really were high levels within you. And, interestingly so, that's how it's noted for burnout within the difference of how it shows up in male versus females. For females, a lot of the emotional exhaustion is how
Okay.
burnout it
100%.
shows up in for us. So it goes along with that. What you started to do was you were incorporating ways on how to overcome it a little bit at a time within yourself. And I'd say overcome more of undo. So I like starting to use, I'm going
Sure.
to start using, undoing some of the knots of burnout. And for you, movement and exercise was one. But you also recognize, so, it's not like you said, okay, some of this is related to the responsibilities that I have at home with my children. So you start to incorporate them in
Hmm.
that, because you said healthy family. I want to make sure that they recognize and are incorporating some of these positive coping
Right.
skills for themselves. So movement with a family of four. How does that look? How does that look?
So it looks many different ways
Yeah.
depending on the situation. There are days where, so I am a home exerciser because with the kids, it's me and my husband right now. There is no other childcare at this point. So I
Mhm.
do a lot of stuff at home. So
Mhm.
depending on what my plan is for the day, there are times where they are my cheerleaders and like I'll
Yes.
be on the treadmill and they run in place behind me and
I
they'll
love
be
it.
clapping. If we do a lot of times, actually, my husband's involved now too, where like if I'm cooking dinner, he'll put on a yoga video and everybody's doing yoga together, including the 1-year-old. who
Yes.
just is like on the mat in the way of everybody else.
But he's
Yeah.
exercising and cheering
Well,
you on.
exactly. So that's kind of the more, the more traditional type of movement, but
Mhm,
we are outside every single day.
mhm,
We live pretty rural. We have a lot of space outside. And so we are scootering, biking, walking, running,
mhm,
swings, like all the climbing trees, all of those kind of more kid type play activities.
mhm,
We really try to make it fun so that it's
mhm.
not like get outside and get your exercise. This
Yes.
is just part of our life. Like we are active and we do these fun things outside as a
Yes.
family. So you're
Mhm,
you're getting that movement, you're teaching them the importance of health and wellness, but you're
mhm.
also creating family memories and bonding. And it's kind of a nice way to wrap that all into one.
Love it, love it. And you're outside, you're with nature, and the kids, they're not realizing. They're just like, this is
No,
fun. And
yeah,
mommy's like, and I'm getting
exactly.
my exercise and
Exactly,
I'm
exactly.
getting mental health. I'm able to give in. And also when you're out there with nature, immunity, you're boosting your immune system. There's
Mhm.
so many positive attributes of just the movement. Now, one of the things, this at the time of this recording, it is Mental Health Awareness Month.
Yeah.
And the movement is a great way, as we've said, to tap in to helping to overcome some of the prevalence and what happens within the within our population, which is mental health. And the thing is, to mental health issues happen to all of us.
Right.
You know what I mean? We've all
Yeah.
been through it. So we've all been through phases where you don't want to, you're either anxious, or phases where you're either not completely diagnosed as depressed, but you're headed to that veil,
Mhm.
depression veil. And
Yeah.
movement is a way to pull you back from that. Now, when is it that you noticed within that your life has gotten so hectic that, like, whoa, I need to make a change? Was it between like, which was it, like, okay, after my first to second child, or was it like, okay, once I hit, like, my fourth, like, okay, wait a minute.
So it was definitely after my first. And I was talking about this with somebody else the other day.
Hmm.
I still find it so like funny that the more kids I've had, the more consistent and the more exercise I have been able to do.
What?
Yeah, so it's like what, like I don't know. So that was part of why I started making videos about exercise, because I started to realize, like, okay, I like something that I'm doing is working. And when I
Yes.
sat down to like write some stuff down and think about it, it was like, okay, here's all the things that I have done to be able to be even more successful the more
Hmm.
kids I have.
Right.
Um, so for me, it was really after my second daughter, like, my second daughter. I only have one daughter. After my first, which was my daughter,
Hmm.
um, I just was in a mindset where I still hadn't fully made that redefinition of exercise yet. I
Hmm.
couldn't do the 1 hour to 2 hours a day. I really was not doing much. I mean, I walked the dog with her on a relatively regular basis, but at
Hmm.
the time, I didn't count that as movement.
Yeah.
I was beating myself up in that postpartum period because I was felt like I was seeing all these other people that were thriving and like getting it all done, and I was felt like I was barely staying afloat, and I
Hmm.
really wanted to move and exercise more, but because of my mindset and my definition, it was
Yeah.
holding me back, because
Absolutely.
like I said, I was just not, I was like, okay, if I can't do an hour, I'm not doing anything. And
Hmm.
it just got to be this like beating myself up almost during that
Hmm.
time.
Hmm.
And so it was like soon after I had gone back to work after her was that moment that I talked about earlier, where I was saying that to the patient about 1 minute a day. And that's kind of when the seed got planted for me. But it really wasn't until I was postpartum with my second when I really embraced the
Hmm.
a little bit at a time, and the giving myself grace. Because that was something that I never did before, because again, that was when I was getting more into that burnout phase.
Yeah.
And I just was like, I'm not checking all the boxes. I'm the worst. Like, I can't believe that this is me. And then when I started to make that shift of, you got outside, you walked 2 dogs, 2 kids under 2 by yourself in Houston when it was like 100 degrees. Like, come on, girl, you're doing good. So, like, write that down. Good work, you know? And
yes.
when I started to actually like say it out loud, it was like, okay, this is like, I need to celebrate these little wins and give myself grace. And that's what I've done ever since my second. And so each pregnancy, each delivery, each postpartum period, I just have stayed consistent because of that mindset shift.
You said something very important too a little while ago. You started to say it out loud to yourself.
Yeah.
And when you're saying it out loud, you start to recognize that you are really doing a lot more than you think, and you're giving yourself credit for, right? When we're sitting with the thought of the perfect schedule, the perfect exercise routine, I don't even use the word exercise as much as movement. I like to use the word movement because it differs for others, for everyone. You know, you have those who, when people think of exercise, they're thinking of, you know, just powerlifting consistently or running for 45 minutes on the treadmill and being able to do, you know, all the big squats and sometimes movement is you listening to that song at home that gives you energy and dancing along and jumping and, you know, and you're getting, and like you said, movement at times is walking that dog around the block. And, you know, sometimes the dog is just like, okay, 2 is not enough. I'd like 2 more. So you've really now added more laps to that. But if you say it out loud, you realize like, wow, I've actually been moving. And these things are just as important as setting the time and being able to drive to a physical location, such as a gym, and doing it. So I love that this is for those who you're really managing your mindset and your outlook on your definition of what exercise is, how you do it, how are you able to incorporate it in your daily life? Because to be able to say I've exercised daily, it's good. But you know, if you think about, like you said, that 1 minute of walking around the couch, I'm pretty sure that patient started to feel like, oh, I am exercising.
Right. Exactly.
You know, and then they define themselves as somebody who moves. And no, I'm not someone who is not an exercise enthusiast. Yes, I'm an exercise enthusiast. It doesn't mean that I, you know, do that, but I am enthusiastic. I'm at home. I'm moving daily. I'm incorporating this, and I'm seeing the physical and mental benefits from it. So yes, I exercise daily. I love it. And it changes the way you look at yourself, your definition of yourself, right?
Yeah. And I think it's so important to always just compare yourself to the you of yesterday, right? So like if you yesterday did 0 minutes and you today did 1 minute, awesome. Like write that down, say it out loud. You're doing great. It doesn't have to be, well, Bob over there did 30 minutes and he sweated. Like, no, good for him. Like, yay. But you don't have to compare yourself to him. Just think of who you were yesterday, who you are today. And then that helps with the mindset also.
Absolutely. The metrics and the mindset of improvement, consistent, small improvement is better than none at all.
Exactly.
All righty. So with that in mind, I now have my fun question of the day.
Okay, I'm ready.
You sure? Well, let me see if I'm ready, because I
Uh-oh.
I love it. I love it. All righty. So if you weren't a doctor, and you can't do yoga. You're not. I I told you.
You knew that was going to be my answer.
I told you, you're not a yoga instructor, the exercise enthusiast. You're not there with the cheerleaders like your kids. They're cheering you on. And I'm not a competitive swimmer.
Okay.
Um, Let me hear, what else did you say? So we're climbing trees. We're riding bikes. Okay, what would you be?
So probably an early education teacher. And
Oh,
the reason why I say that is because a lot of my mindset shifts are actually from watching my kids, like
mm-hmm.
seeing just how these things that we like are so everyday for grown-ups, and like the joy and excitement and exploration and learning that exists from like a dandelion, like truly a
Yeah,
dandelion, and you're like, because it has all these different phases and they're so excited to see how it changes. And you're like, as a grown up, you're like, oh, this is a weed. Like, it's so annoying. Get it out of my grass. But
yeah.
when you stop to watch them and how
Mm.
they experience the world, and you take a minute and take a breath and you think about, like, wow, if I could experience the world that way, my life would be wildly different. And I mean, obviously, everybody is always a work in progress, but that piece of things has definitely helped me along the way. And I think one, that's why I have so many kids, but two, how I have been able to be more consistent the more kids I have because of
Mhm,
that mindset that I've picked up from them. So I think
mhm.
I would be that teacher because one, I would be around them all the time and get to experience that mindset. And two, just watching them grow, like the rapid growth that exists in that
Mhm.
younger age, is just awesome because we can grow like that too as adults. We're just not, we don't practice it as much as they,
Yes.
so that's my answer.
I love it. Actually, you were my first early childhood ed, and we ask this question to almost everybody.
Okay. I'm
So
unique,
yeah,
I guess.
we've had some of the older, but the first early childhood ed. And when you think about how you've described, the reason behind it, I really do truly love it, because kids are very exploratory, and they're exploring life. This is new, it's fascinating to them, and
Yes.
they're not taking it for granted. We
Right.
have gotten to the point where we're just taking it for granted, like, and we're seeing things from a different lens. Like you said,
Mm-hmm.
that they're seeing the dandelion and you're like, oh wow, they're floating, and all these, they look like little umbrellas floating.
Yeah.
We're like, oh, now that it's there, now
Right.
I'm gonna have a patch over here and a patch over
Yeah.
there. But we're looking at life from different lens. They're exploring, and like you said, there's rapid growth, but rapid growth in appreciation, rapid growth in gratitude that's
Mm.
happening during this time, rapid growth in grace.
Yes.
Because as we said, like, they try new things. It doesn't work out. And they're not like, oh, well,
No.
I
Keep
tried.
rolling. Yeah. Just keep right on rolling.
Yeah, they keep right on rolling. Like we said, like, a lot of times a kid who is just learning how to walk, they fall and they just bounce right back up and just
Exactly.
keep going. And we can learn a lot from taking the time out to look at our inner child, or to look at a younger version of ourselves within these children. And what is it that we lost along the way? And what can we bring back? What are some of the mindsets that we can really use and learn? Maybe that's why the book, right? Everything I learned about life, I learned in kindergarten. Maybe that's why
Yes.
the book's so popular, because there's so many things that we've lost along the way that we could truly, really learn from our little ones. I love it. See, there you go. The pediatrician and you came right back
Yeah.
around.
There you go. Full circle.
Full circle. All righty. So now we have some people who have been watching and listening to today's conversation. And they're like, you know what? I like the way that Dr. Ionescu thinks. And she has videos out there showing us
Yeah.
how to exercise and how we can incorporate it. Like, how can I find her? Where can I find all of this stuff? Where can I be a part of Dr. Sara's world? Tell them, where can they
Sure.
find you?
So I post reels daily to Facebook, Instagram, and then YouTube Shorts. On
Mhm,
all of those platforms, I'm Dr. Sara, so DR, and then my
mhm,
name, Sara Ionescu. So it's SARAIONESCU. That's also my where I am on LinkedIn. And
mhm.
then I do have a website where I am going to start doing a free newsletter, which will be just a an email version of the video type of like same type of content.
Mhm.
So that website is also my name, so it's dr and then saraionescu.com. So I
Love
think
it.
those are all the places that I am.
All righty. Love it, love it, love it. So, those of you who are out there who are too busy, huh?
Yeah, go
We've
on my
learned,
Instagram.
yes, we've just learned. She just schooled us, like we'll say,
Yeah,
right? In our very her early childhood education way, where she teaches us that even just a minute a day of movement, we know the benefits. We know and we've read all of the benefits of exercise on our physical health, the movement, the guidelines that are out there. But sometimes we use that as a deterrent versus using it to help to encourage us. So, yes, it'll be great to be able to say you've done 30 minutes of vigorous exercise, but even 1 minute of moderate, 1 minute of light movement is a step towards better health, and not just physical health, but better
mental health.
emotional and mental health. So we're going to use all of that. Okay, Dr. Sara, you can use this as your accountability partner.
Absolutely.
Okay, so because of that, you are posting very, very, very consistently and
Yeah.
showing us that there are different ways for us to incorporate that. Even when you're a busy mom of four, if you have not moved in a long time, if you've used all of these mental, I don't want to say excuses because that has like a very negative connotation. But if your mind has told you that it doesn't matter, it's not worth it, then this is a time to really pull from the energy that Dr. Sara Ionescu has out there. And you can follow along with her on her website, drsaraionescu.com, or on her YouTube shorts, the Facebook reels, and in the Instagram, where she's posting ways for you to just have movement and to be able to incorporate it in your daily life. All
Yeah.
right. Love it, love it, love it. So, Dr. Sara, do you have any last minute words for those who are watching?
Yeah, I was just going to say you don't have to have a history of being an athlete. You don't have
Mhm.
to have any background. You can have not been active most of your life. You can still get started with this and move. It's it can be slow, little teeny baby steps, but those steps build up over time and it will change your world. It will
Mhm.
absolutely change your world because you'll start to realize, wow, I can do this. And I was an athlete. I struggled with exercise for a long time and now I'm back to it and you can do it too.
Love it, love it, love it. So, this is from someone who, like we said, she was an athlete, but she still struggled with that during the different phases. And then we said you recognize the phase of the life that you're in, and then you honor
Right.
that phase, and then you work during that portion. So, with that, we're going to end today's wonderful conversation. But I know what you're thinking. Ah, there we go, Dr. Beckford. Man, I'm coming in at the end of this, and you're talking about, the different phase that you're in and honoring it with exercise. I didn't catch all of it. Have no fear. This wonderful, wonderful conversation is available on our Your Caring Docs website. That's URCARINGDOCS.com. Select podcast. You'll see Dr. Sara's beautiful face. Yes. Download the episode and share it with 10 of your friends. If you are a doctor out there and you're like, you know what, I'm doing amazing things too, just like Dr. Sara, and I want the world to know about it. Hey, I want the world to know about it too. Send me an email at drbeckford@yourcaringdocs.com to book, and then we'll send you the schedule and get you on. Do keep in mind we are booked out 3 months in advance. It's just because there's just so many amazing physicians out there like you guys. And we have been talking about burnout and ways to overcome burnout. And today, Dr. Sara Ionescu gave us one of her ways to undo that, which is movement, helping with the mental health that goes along with burnout. So, if you're looking for a dynamic speaker on stress management and burnout prevention, for your next event, hey, I am she. I'm Dr. Tamara Beckford, and I would love to speak at your event. So send me an email at drbeckford@yourcaringdocs.com and we will get that set up. All right. So with that, we're going to thank you all for joining us. Those of you in the chat, those of you joining us online, and those of you who will be listening to this wonderful podcast. Thank you so much. And we'll see you guys next time. Bye-bye.
Bye.